PETMRI is a hybrid imaging system that combines an MRI scanner with fully integrated PET detectors. It merges the functional and metabolic information provided by PET with the high soft tissue contrast offered by MRI. PET-MRI dual modality is basically an MRI scanner with a ring of redesigned PET detectors under the cover in the middle of the magnet, so both techniques conserve their basic principle. MRI visualizes anatomy in all three planes, axial, coronal, and sagittal. Within the body, protons from water molecules are oriented in different directions. The constant magnetic field created by MRI forces all protons to align with it. The alignment is systematically destroyed by a brief pulse of a weaker electromagnetic field. After the pulse ends, the protons gradually realign with the original constant field. This gradual realignment results in the emission of low-energy radiofrequency photons. The time and amount of realignment change based on the thickness and hardness of the tissue, and so monitoring of the arrival of re-emitting photons in the MRI's detectors allows to identify the location and shapes of different tissues. For the PET component of the hybrid PET-MRI, PET scan uses radioactive tracers to create 3D images of the body. Radio tracers are made by attaching a radioactive atom to a carrier molecule that can bind to specific molecules in the body. The kind of tracer used will depend on the purpose of the scan. The radionuclide in the organ or tissue being examined releases positrons, which are subatomic particles that interact with nearby electrons, producing gamma rays in opposite directions. A computer analyzes the gamma rays and uses the information to create an image map of the tissue being studied. The amount of the radionuclide collected in the tissue affects how brightly it appears on the image and indicates the level of organ or tissue function. During the procedure, the region of the body to be scanned is divided into smaller portions called beds. Depending on the patient's body length, in a full body, head to thigh, usually 5 to 7 beds are acquired. Both MRI and PET acquisition is done in sequential blocks of PET positions, from cranial to caudal. The high resolution and sensitivity of PET MRI captures minute details and produces superior three-dimensional images. The potential areas of application include neurology, cardiology, and oncology. In neurology, it provides diagnostic benefits and/or treatment planning for stroke, gliomas, and degenerative disorders. For instance, it optimizes the treatment planning in patients with ischemic stroke and aids monitoring of lesion progression. It provides structural, functional, and molecular imaging in patients with brain tumors, leading to further understanding of tumor microenvironment. It also increases the accuracy in differential diagnosis, especially during early phase of degenerative diseases. In cardiology, it exploits the superior tissue contrast inherent in the MRI component and the functional information provided by PET in cardiac disease stages, leading to increased potential of plaque characterization in atherosclerosis and cardioprotection during acute myocardial infarction. This T2-weighted short-axis image corresponds of a 59-year-old patient with a 7-day-old myocardial infarction after an interventional reperfusion of the right coronary artery. The window shows edema in the inferior and inferior septal myocardium, which visually correlates well with a significantly reduced glucose utilization of the affected myocardial section in the PET scan. This correlation is well illustrated by the fusion of both images. Among the oncology applications are early tumor detection and radiation therapy planning. Tumor phenotyping is another key potential role of PET MRI, given the range of quantitative biomarkers available. The ability to use these parameters to distinguish less from more aggressive tumors could have profound effects on risk stratification, prognostication, and management strategies. Added value in cancer staging is especially important in the evaluation of the head and neck, the skeleton, the liver, and urogenital organs, in which MRI plays a crucial role in the diagnostic process. Regarding prostate cancer, PETMRI allows for precise mapping of PET-positive lesions, and it is therefore clearly advantageous over PET-CT, where an anatomical allocation is difficult due to the reduced tissue contrast of the prostate in CT. These scans correspond to a 73-year-old man with history of 2 negative prostate biopsies who presented to the doctor with recurrent symptoms of nocturia, frequent urination, dysuria, difficulty starting urine stream, and abdominal pain. The T2-weighted MRI component of PET-MRI showed a hypointense lesion in the midline anterior transition zone and a benign hyperplastic lesion in the left. Combined PET-MRI image showed a specific uptake within the midline anterior transition zone lesion, suggesting a possible cancer, but no uptake by the benign hyperplastic nodule in the left transition zone. Later biopsy of this lesion revealed prostate adenocarcinoma, which is consistent with the symptoms presented. Hybrid PET-MRI is currently used in the UCH Macmillan Cancer Center, not only for imaging patients with cancer, but also to investigate heart and brain function. This is the future of medical imaging, as it allows a non-invasive functional assessment coupled to a high morphological resolution with low radiation exposure and reduced time.